Chances are you or someone in your family is impacted by AFib, the most common heart rhythm disorder. An estimated 3 to 5 million Americans have it.
Atrial fibrillation is an extremely common condition where the upper chambers of the heart, or the atria, begin to quiver rather than contracting symmetrically with the lower chambers. It can sometimes cause palpitations. It can increase risk of stroke.
If blood doesn't fully flow through the heart, remnants can collect and form clots, which may in turn lead to stroke, making diagnosis and treatment of AFib extremely important.
There actually is a calculator that helps us estimate the annual risk of stroke in someone with atrial fibrillation.
In 2014, both the American College of Cardiology and the American Heart Association gave the nod to anticoagulants or blood thinners as a first-line treatment for most people.
In most patients who are asymptomatic, we're actually able to control their heart rate and reduce their risk of having a blood clot with a stroke by using medication.
Someone with AFib faces a 5 times greater stroke risk than a person who doesn't have it. While it's clear treatment is beneficial, a segment of patients have AFib that can't be controlled by drugs or still have symptoms including palpitations, fatigue, or shortness of breath. It's those people who may want to consider next step surgical treatment.
Sometimes a procedure called an ablation type procedure might be performed to try and maintain normal rhythm to reduce symptoms.
Interventions that disrupt AFib may alleviate symptoms where medications do not, but doctors warn not to automatically expect to do away with drugs.
We need to be cautious about doing the procedures in order to discontinue the anticoagulants until we've got really good long-term evidence that there isn't recurrence of atrial fibrillation.
When it comes to medicating AFib, the best approach is to work with your doctor and determine the best treatment for you. For Lee Memorial Health System, I'm Amy Osher.